Hi, it's Dr. Somji from Nip Talk. We're going to be talking about everything in cosmetic surgery, from invasive procedures to non-invasive procedures, all the way through to skin treatments as well. You've asked your questions and I'm going to provide the answers. Stay tuned. I've got a great question here. It says, what are the risks with filler? So, whenever a patient comes to the clinic for dermal filler injections, we always go through a consent form. And it's at this point in time, if they've been to different places or even if they've had filler for a number of years, they kind of get a little bit surprised when I talk through all the possible complications. Mainly because sometimes they're overlooked. Now, really, dermal fillers are extremely safe and complications are really quite rare, but it's really important to know what you're getting into. So I like to split any form of complications into two different entities. The first one is common injection related side effects. So if you're going to put a small needle into the face, what can you get? Well, you can get a little bit of bleeding, swelling, bruising, and even tenderness over the area for even up to about a couple of weeks. But normally after about 48 to 72 hours, it feels pretty normal after that. The second category are any kind of like side effects that can occur directly with filler injection. So an allergic reaction can happen, and this tends to happen less than 1 in 15,000 injections. So if you're an individual who've got numerous allergies, then you might want to be a little bit cautious before taking on filler injections. But to be honest with you, I see it very rarely. Immediate swelling happens, but if you're in a clinical setting and you've got a doctor treating you, you'll be absolutely safe. Then you can get kind of lumps and bumps, so you can get kind of swelling and firmness over that area. Normally, after fillers are injected, you can get that little bit of swelling, and if you touch it, it might be a little bit firm, but over the next 2 weeks, all of these things die down. And that's a really important point. You just want to wait a couple of weeks to make sure everything settles down, and when you turn up for your review, then your doctor can go through any concerns and we can treat these things. Obviously, we sterilize the area before we start, but sometimes an infection can occur and you're effectively putting in a liquid implant, so we have to make sure that everything is sterile afterwards. If you were to get an infection, then antibiotics are your best friend. And then the other thing which really increases safety ratings of filler is that it can be reversed. So I can inject an enzyme in that area to dissolve the filler, and guess what? The concern dissolves away too. Some of the more serious side effects are really quite rare, but they're important going forward. One of the worst complications that can happen with filler is putting it into a blood vessel. It'll block whatever that blood vessel is supplying. So it could be skin overlying an area, resulting in a shallow scar, and it can even block blood vessels that supply the back of the eye, resulting in blindness, and in certain incidents, even stroke too. Now, this is extremely rare, and we reduce this effect in 3 different ways. A, I know where I'm going. So as a surgeon, I know my anatomy in the face, and I know some of the variations, and we always inject in areas we know that are safe. Secondly, in areas where we've got more superficial blood vessels and we want to be a little bit more gentle and make sure we don't put filler in a blood vessel, we use a blunt needle called a cannula. So if you imagine you've got a blood vessel that's sitting like this, you've got a sharp needle, it can go through and it can put a filler in it, but if you've got a blunt needle, it's going to gently slide past. Thirdly, it's my mantra always, less is more. So if you inject less filler in one sitting, you won't get so much swelling and also reduced risk. Thankfully, like I said, a lot of these incidences are immediate and are as a result of injectors that do not really know their anatomy so well, and things can be resolved pretty much quickly and immediately with an enzyme that dissolves filler. So next time you go for filler, make sure you ask your doctor your concerns and make sure they go through an adequate consent form so you know the risks that you're facing. But just take us back to the beginning of this video. Dermal fillers are really safe, but in the right hands.